The gift of love, infant mental health. The child learns to love through his first human partners, his parents. We can look upon this very miraculous occurrence as a gift of love to the baby. We should also regard it as a right, a birthright for every child. So said Selma Freiberg long ago, 1977. It was her pioneering work with infants, toddlers, and families over 40 years ago that led to the development of a field in which professionals from multiple disciplines learn to work with or on behalf of infants, very young children, their parents, and the relationships that tie them all together. The intent was to promote social and emotional health through the security of early developing parent-child relationships in the first years of life. One hopes that for most babies and their families, the pathway to healthy development and loving relationships will be a very smooth one. For many, though, the pathway to parenthood is far more difficult. Prospective mothers and fathers may face challenges that seem insurmountable. The pregnancy may be unplanned, or it may be unwanted. Neither parent may really be prepared for the care of a baby. The mother may be depressed, and the baby, when at home, may be really difficult to care for. In the absence of another caring adult, if the mother is alone, she may feel overwhelmed by the baby's needs. If the mother has experienced trauma, or the father, abuse or neglect, they may be at increased risk for providing themselves neglectful or abusive care for the baby. Well, what will she do? What will the father do? How will their baby fare? How will their relationships with one another unfold? These, and questions like these, were addressed by Selma Freiberg as she developed so long ago the approach to service that she called infant mental health. How an infant or toddler is cared for, as well as the stressors in both the infant's and parents' current lives, shapes the course of early development for that baby. And as Jack Shunkoff once said, sets either a strong or a fragile stage for what follows. Sobering words. To the extent that parental care is nurturing and experiences for both infant and parents are positive, the developmental course for the baby will most likely be positive. When parental care is neglectful or trauma occurs, early development may be compromised, and the social and emotional needs of the infant or toddler then placed at grave risk. Early identification of these risks, intervention or treatment with both baby and parents may help to reduce the risk of developmental delay or failure for the baby, relationship disturbances for parents and children, or disorders of infancy. As John Bowlby observed so long ago, the course of subsequent development isn't fixed, and changes in the way a child is treated may very well shift the pathway in either a more favorable or a less favorable direction. It's this persisting potential for change that gives opportunity for effective therapy. I think that's where we come in. It's the promise of something better for babies and their families. Infant mental health. So a little bit about the framework. What is it anyway? Well, these services promote optimal well-being, beginning in pregnancy and continuing through the early years. They prevent developmental, behavioral, and relational disturbances in those first years of life. They offer a pathway for intervention when the biological or environmental or psychosocial risk factors really place the baby's development in jeopardy and the relationship at such risk for failure. These services treat infants, toddlers, and parents, when identified, as having a sensory, regulatory, or mental health disorder requiring immediate care. So we're going to think about promotion, we're going to think about prevention, intervention, and treatment. All of those are important to infant mental health. So what's promotion? It could be thought of as support for those brand new parents with the offer of very practical information and education. How do you get ready for labor and delivery? Who needs to be with you? What do you need for the baby at home? What does a very new baby need in the early years? Promotion might also be the identification of strengths that really support the resiliency in infancy and early childhood and parenthood. We offer social support through our relationships to strengthen and deepen the early developing relationship between parents and young children. For instance, a parent group, a neighborhood gathering, father-baby play groups, infant massage, things like that, that promote the early developing relationship and positive care. So infant mental health is also about prevention, where we would have screening and assessment by health, mental health, and early childhood professionals, where there might be concerns about a difficult pregnancy, or a development that's slightly delayed, or behavior that doesn't seem quite right, or a relationship that's a little bit off track in the first years of life. If we can identify early those situations, we might be able to prevent risk down the ensuing years. We'll make referral, if we identify risk, to those who might be able to offer support, consultation, intervention for a short period of time to get everything back on track. Prevention might also include guidance and emotional support to the parents as you're working with parent and child together to reduce the difficulty that may be ensuing between them.
That's okay.
To reduce the biological and environmental and psychosocial risk factors that place the pregnancy in jeopardy or the family at risk in their relationship. The kinds of strategies could include the sharing of information, developmental guidance, education for young parents or new parents, and services to the infant and parents together. Could be in a community setting or in the family's own home. Home visiting services are very much coming to the attention of providers and systems across the country. When a baby is seen and a family is seen in their own home, in their own territory, we can often do so much to promote more positive interaction and exchange. Intervention is a little bit more serious. Screening and assessment indicate that the infant or the parent are really at risk for developmental delays, a relational disturbance, or emotional upset disorder. If we can identify a specific risk or multiple risk factors early on, we may then be able to refer that family together for services that will truly promote the baby's social and emotional well-being. We can avoid sliding down that slippery slope of risk. Intervention strategies could be, again, developmental and educational, relational and psychotherapeutic. Strategies are clearly defined and target the infant or toddler, at the same time the parent or both parents and the developing relationship that they're engaged in or not. The approach is primarily strength-based, but attention is given to the vulnerabilities that place the family at such risk. The orientation is to the immediate concerns, the present, what's happening now, as well as to the past, combining concrete help, emotional support, developmental and interactional guidance, advocacy, and psychotherapy, all as needed to reduce the risk, enhance the capacities of everybody referred. Keeping the baby, the mother, the father, and their relationship in mind at once is challenging, but that's really the essence and the uniqueness of infant mental health. More serious concerns require treatment. When a social, emotional, sensory, or regulatory disorder is really clearly identified in the first years of life, and when a parent is identified as having a major mood disorder or a mental illness, or has experienced a recent trauma, all of them, the baby, the parents, are at risk. They may require treatment by a professional who has specialized training in psychotherapy and behavioral theories of change, disorders of infancy, mental and behavioral disorders in adulthood. It's like putting a big puzzle together, because one needs to know about the baby and the baby's development, about the parent and the needs of parents as well as their adult mental health, support for both of them together. So the strategies include everything that I've said earlier, identified as intervention strategies, but really may require more intensive focus in treatment by the practitioner or the other professional who's stepped forward from mental health, the pediatrician perhaps, the educator, child welfare folks. In some instances, treatment is going to require everybody wrapping around the baby and the family for support. The infant or toddler, for example, may really require some targeted treatment due to abuse and neglect, and abandonment, or placement in foster care. A specialized program for sensory and regulatory problems, perhaps by an OT, an occupational therapist, or a physical therapist. If the baby's been hospitalized for chronic illness, that baby might need special monitoring by the healthcare professionals. But the parents, too, may require a psychiatric evaluation, medication, even hospitalization to address emergency or significant mental health issues. And at that point, we easily could ask, well, what about the baby? How can we attend to both the baby and the parent? In all instances, the practitioners remain attentive to the early developing relationship and strategies that address and offer therapeutic support to both the parent and the child. Treatment within a preventive intervention framework requires a high level of training and support for the infant mental health practitioner who's providing services that are developmental, that are health focused, that are mental health focused to the infant or toddler and parents referred. A very experienced practitioner will provide this treatment to both the infant who appears to have a disorder and to the parent whose mental health needs are identified. But often, the newly minted practitioner needs to recognize when additional expertise is warranted and work in collaboration with others who can meet the guidelines for competency in infant mental health and also experience being carefully supervised.